Hello. This series of videos, we're going to cover some of the common integumentary disorders. So when we talk about the integumentary system, we're talking basically about the skin. Hair and nails can also fall under this classification, but what we're going to cover for disease processes are primarily going to affect the skin. All right? So we're talking about lesions that are going to be caused. And we've got two classifications with lesions. You can have what's known as a primary lesion. And this is going to be the initial cause of typically either an inflammatory event or other event that causes the skin to not look normal. All right? With the primary lesions, typically what we're talking about causing primary lesions, things like cancer, with skin cancer, bites, like mosquito bites or spider bites would fall under this category. That would cause a change in the skin. And then the two biggest that we'll actually cover are going to be bacterial and viral infections. So typically when we're talking about a primary lesion associated with the skin, it's going to be something bacterial that gets into the layers of the epidermis and starts causing problems, or it'll be a viral infection. Okay, those are going to be the two most common. We also will have secondary lesions that can be caused within the skin. All right. The secondary lesions, these are going to be things that are caused by external environmental factors. And part of that environmental factor, and really the biggest cause of the secondary types of lesions associated with the integumentary system, the thing that goes along with skin issues is that they itch. So the individual scratches, and that causes further damage to the cells associated with the skin. All right? So with our primary lesions, there are going to be a couple of classifications that you would use in order to diagnose the primary lesion. All right? The primary lesion will either be non-palpable, meaning you can't feel it. And I'm going to switch markers because the orange is not working so well. All right? So non-palpable, it's not something that you can feel as you touch the skin. All right? So things that would be non-palpable, pigmentation disorders. So with vitiligo, a lack of pigmentation, that would be a non-palpable type of skin lesion. The freckles that you've got on your skin from the melanin that produces that, that would be a non-palpable lesion as well. Then we have palpable lesions. Palpable means you can feel it. When you touch the skin, it feels raised or it feels different. Typically, it's going to be raised, okay? And with our palpable lesions, they can either be solid or they can be fluid-filled, okay? So with fluid-filled, you're talking about things like pustules. So pustules might be something like with acne, where you've got a bacterial infection in the sebaceous gland. You can feel there's something that moves in there. It's a little bit liquidy, all right? Solid, we're talking about a nodule. So things like fibromas, skin cancers can sometimes be solid and palpable. Those things are going to fall under that classification, all right? So our primary lesions, they're either non-palpable or they're palpable and either solid or fluid-filled. All right. Hopefully that makes sense. In the PowerPoint, I've got a whole list of definitions of the different descriptions of what describes a wheal, which a wheal would be like a reaction that you have to a mosquito bite, where you've got kind of a raised area and it radiates outward. Vesicles, pustules, what you want to go through is study the definitions of each of those, know what the definitions of each of those are, okay, for the test. All right. So that is kind of just a short introduction to the integumentary system. The next video, I'm going to talk about skin cancers. I'll have a video on viral and bacterial infections. So look for those as well. Thank you, and if you have any questions, please let me know.